Hi, my friend. Right, so today our focus is actually on the LGBTQ plus and the stigma that surrounds this particular population and groups, right? And typically, if you've been on this channel before, you will know that the information that I share or the content that I produce is actually based on the mood of the day. It is based on the conversations, health-based conversations that are happening in our communities, right? And something that has come up this week a lot is on LGBTQ plus and the stigma that I observe that is surrounding this particular population. And therefore, I am supporting myself with evidence-based, informed research to support this conversation that I'm going to be having. So I am on the Lancet. This is a public health journal. And I am reading an article that is titled Structural Stigma and LGBTQ plus Health, a narrative review of quantitative studies. This is an article that was published in February 2024, right? This is this year. So one of the key things that I'm going to read about is the actual stigma that they talk about in this article as it relates to the LGBTQ population. And here we go. LGBTQ plus populations are at elevated risk of adverse mental, behavioral, and physical health outcomes compared with heterosexuals. The magnitude of these disparities has prompted the identification of causes, including those at the structural level. Stigma has long been conceptualized as one structural cause of health inequalities among marginalized groups, including LGBTQ plus individuals. However, stigma research has been criticized for being narrowly focused on individual and interpersonal processes such as self-stigma and discrimination. Indeed, stigmatized individuals can experience negative outcomes even if they have not encountered interpersonal discrimination, right? And so I just want to emphasize again, structural means the laws, the policies, right? Organizational laws and policies, national laws and policies. That's what we mean by the structural stigma, right? And the self-stigma, as you may well be aware, this is the stigma that comes from within yourself, where you stigmatize yourselves internally. You stigmatize yourself internally, right? And then what else do they say about this particular form of stigma? Right. Laws and policies are influenced by the attitudes of residents. Consequently, scholars have also measured structural stigma by aggregating individual attitudes towards LGBTQ plus individuals to the community level, right? This approach has demonstrated substantial heterogeneity across communities with respect to their level of stigma, right? So stigma is informed by the communities we live in. Stigma is informed by the communities we live in. Stigma is informed by the attitudes of the people in our communities. And also stigma is informed by the law, right? So this is all why we talk about the intersectional kind of stigma coming from all aspects, not just stigma that is coming from perhaps the healthcare workers, not just stigma that is coming from friends and family, but there's also stigma that's coming through the laws and the policies, and collectively what we stigmatize or what we agree is the stigma codes and the stigma symbols that we associate with certain populations, right? All right. And let me see what else I can pick up from this article. Actually, what I'm trying to do is to break down the critical pieces from these research-based articles, because typically there's a lot of terminology that would need to be broken down. So for the sake of ensuring that you get the message from this article that is research-based, I'm going to share the elements of it or the aspects of it that are user-friendly and digestible. Alrighty. And just let me see what I can find in terms of the conclusion from this article. So in conclusion, in this comprehensive review, we found an accumulating body of evidence that structural stigma is associated with multiple adverse health outcomes in LGBTQ plus populations. In addition, research has identified numerous candidate mechanisms through which structural stigma might affect LGBTQ plus health outcomes, including individual or interpersonal stigma processes such as self-stigma, including healthcare-related factors, e.g., utilization of health services, biopsychosocial risk factors such as social isolation and stress physiology, material resources such as earnings, and relationships or family processes, e.g., partnership stability, right? So this literature shows that nevertheless, we identified several key gaps in this literature. In particular, the next generation of structural stigma research should incorporate intersectional approaches, conduct longitudinal studies, testing the mechanisms through which structural stigma shapes LGBTQ health, and develop structural stigma measures for specific LGBTQ plus subgroups. So essentially, they are showing how this form of LGBTQ related stigma affects health outcomes, right? First is self-stigma, and then it also negatively hinders access to healthcare treatment and services. And it also may increase social isolation by those who feel stigmatized, the stress levels of those who feel stigmatized, and it also affects their earning potential, right? And the capacity they have to have partnership stabilities. All right, so this is an article that I'm reading from The Lancet. It's a public health journal, and they are talking about structural stigma and LGBTQ plus health. All right. All righty, my friend. This is the end of this section, and I hope you're having a lovely day where you're watching me from. But most importantly, I hope you're having a healthier day wherever you're watching me from. All righty. Bye.